TAVR stands for Transaortic Valvular Replacement. It's a way to replace the valve in the heart, the aortic valve, without doing traditional open heart surgery.
With this procedure, we can go up through the groin, through a vessel that goes back to the heart, and deliver the valve into the aortic position, or where the aortic valve normally sits. We push the old valve out of the way and place a new valve in its place. The TAVR procedure is a procedure that's designed for us to allow us to treat patients who would normally not be candidates for open surgical procedures. It treats a very common disease that affects many Americans. That includes aortic stenosis. When patients have aortic stenosis, they have difficulty breathing, get tired very often, and fatigue. This offers a lot of advantages over a standard surgical technique in the sense that it allows patients to get back to their normal routines faster and more easily.
The TAVR procedure takes about an hour.